Hello, my name is Briggs.
And I'm Liz Viggers, and we're directors of Quench Arts.
So this video we want to talk about why we set up Wavelength in the first place and why we think music is a really useful tool to use within the youth mental health sector. So just for context, Wavelength is a creative music making project for young people aged 14 to 25 with mental health conditions. The project provides musical opportunities for young people referred across the mental health services in Birmingham and Solihull, from early detection and intervention services through to acute and forensic services. These young people face a range of barriers in accessing other musical opportunities, and Wavelength provides accessible and supportive opportunities for music making, helping young people to learn to express their emotions constructively, form musical and social bonds, and also build resilience.
Now, the Wavelength model was actually based on a model called Musical Connections that we'd been involved in managing and delivering for a number of years in partnership with Birmingham and Solihull Mental Health NHS Foundation Trust. And through the course of delivering that adult programme, we'd actually had some applications from children and young people locally who wanted to take part in the project, but obviously we weren't able to accept them onto that project because of their age. So we knew that there was a little bit of a demand locally for a young person's project, a young person's mental health focused project. But obviously, as I'm sure you're all aware, nationally mental health is a huge concern, and particularly youth mental health. Almost 1 in 4 of us show some evidence of mental ill health, and that includes young people. But around 1 in 10 children aged 5 to 16 suffer from a more serious diagnosable mental health disorder, and 1 in 5 young adults up to the age of 25. Nationally, nearly 80,000 children and young people in the UK suffer from severe depression. And what's shocking is the fact that research shows that of people who go on to suffer from lifetime mental illness, 50% of them actually had their first symptoms before the age of 14 and 75% by the age of 24. So to us that really shows a need for an early intervention approach to treat young people quickly and effectively, helping them to build their resilience and keep well before things escalate. Now, we know that young people who have a mental health condition are disadvantaged in other areas. For example, they might miss a lot of school, which then could affect their exam results and potentially their future careers or their aspirations for future careers. And locally, when we set up the project, Birmingham Children and Young People's Plan actually showed that young people suffering from mental ill health were actually 19 times more likely to be excluded from school, which is quite shocking actually. Now, Nick's already talked about the fact that young people with mental health conditions can suffer from a range of barriers in terms of accessing other musical opportunities or mainstream musical opportunities. And we think that generally the young people that we've come across tend to suffer from social withdrawal and a lack of confidence, which then affects their ability to build and develop their communication skills and their team working skills, and also that can affect their friendships and the relationships too. So we think that this is a psychological barrier in terms of accessing mainstream provision, but there's also physical barriers as well. So for a lot of the young people that we've worked with, and we'll talk about this later, some of the young people have had multiple needs. So if they've got a physical disability which then affects their mental health, or if they've got a mental health condition which then might affect their ability to do physical things, then there's an issue there potentially around accessible venues, around providing transport, and sometimes carer and key worker availability to help young people access project sessions. And of course, access to project sessions and transportation to project sessions might also be an issue for young people on the project who, as well as having a mental health condition, might also be a looked after child or a young carer, or might also come from a family where there's a family history of poor mental health. So for example, mum or dad might have periods of being unwell as well. So as a bespoke targeted project, these are access issues that we can address in our project structure and our project planning to make sure that every young person has the opportunity to engage in the project. And we'll talk about the project structure in another video later on. At the time we were designing the project, Birmingham was actually commissioning for a redesign of mental health provision for children and young people up to the age of 25 rather than 18, which was addressing some of the things that were suggested in the Case for Change, which is a document that was produced, which talked about some of the issues and challenges facing youth mental health provision nationally, but also locally there was a report that addressed some of the issues in Birmingham, which include things such as a lack of seamless provision for 16 to 18-year-olds and that transition stage, and support of that transition stage, but also high waiting lists and long waiting lists for treatment, and also poor patient experience. All the evidence showed that locally there were higher percentages of children and young people with mental health conditions than the national norms. So, for example, Birmingham City Council's Child Wellbeing Survey for 2012 to 13, which was looking at 11 to 15-year-olds, showed that 8% of that group had emotional problems compared to 5% nationally, and 14% had conduct disorders compared to 11% nationally. So that's quite significant differences in terms of the need for the project locally. The other thing to say about Birmingham is that it's actually Europe's youngest city, which in itself places demands on local youth mental health provision. Actually, 40% of Birmingham's population is under the age of 25, which is quite significant, so there's some challenges there. And also, in terms of risk factors for developing a mental health condition, actually living in poverty is one of those risk factors. And locally in Birmingham, 33.5% of children under the age of 16 actually live in poverty. So again, that's significant in regards to local need.
We did quite a lot of consultation before setting up the project. So we did questionnaires with 51 young people, young mental health service users, just to see if the project was meeting a need and if they would be interested in actually joining a project if we managed to secure the funding. And out of the 51 people, 90% said that they would like to be involved in a creative music making programme. We also thought it was very important to engage with staff within the mental health sector, so including occupational therapists, those working in CAMS units, and 121 people responded to our survey, and out of those 121, 100% said that it addressed a gap in provision. So far in this video we've looked at why the project was needed, but now we want to look at why music, and why do we believe that music is a useful tool to use with young mental health service users. So to give you a bit of a background, both Liz and I are former music teachers, and we've done degrees, and we've really seen firsthand how music can help us and others along the way. We all know that music can evoke memories, it can help us to relax, it can motivate us when exercising, and there's loads of worldwide studies and research into how music can be used as medicine, and things around reducing stress, lowering blood pressure, reducing pain, and lessening anxiety and depression. A couple of examples of note, Professor Graham Welch from the Institute of Education in London has studied the effects of singing, and he has found that it helps in loads of areas, such as being an actual physical workout for the upper body, and also the brain, how it releases endorphins that make you feel better when you're singing, especially with other people. Also, there's loads of research being completed at the Sidney DeHaan Centre, where they've done a huge study around how participating in music can improve mood, help relaxation, and reduce physical and emotional stress. Through our work on Wavelength, we are committed to building upon this evidence. We really believe that Wavelength addresses the nationally recognised 5 Ways to Wellbeing model, which was put together by the New Economics Foundation on behalf of Foresight. These elements are to keep learning, to connect, to take notice, to be active, and to give. And some examples of how our project can address these elements are: through keeping learning, they are learning new instruments, they are learning the craft of songwriting, and they're learning from others. To connect, they make friends on the project, they collaborate with other people, they learn how to work as a team. To take notice, they gain inspiration from around the world and from their own personal experiences to influence their songwriting. To be active, they participate in our projects even though they may come from somewhere that's completely isolated, so they'll initially come to one-to-one sessions and building up that confidence level to actually access group activity. To give, young people have a safe environment where they can voice their own opinions and take on board other opinions as well, and also to suggest their own musical ideas. Wavelength also helps to achieve at least 7 of the 10 ways to look after your mental health from the Surviving or Thriving report put together by the Mental Health Foundation in 2017. For example, to keep in touch, we encourage young people to actually build friendships that last outside of the project sessions, not just within them. To talk about your feelings. Through lyric writing, the young people are able to express their emotions and develop their emotional literacy. And to do something you're good at. We really like to celebrate the achievements of the young people on Wavelength through producing a CD and a really nice showcase event at the end of the year.
So how does Wavelength specifically help? Well, we've already talked about some of the barriers that young people face, or young people with mental health conditions face, in terms of accessing mainstream provision. And these can be psychological barriers and low self-confidence. And obviously in terms of Wavelength, it's a targeted project, as you might imagine, which enables young people to engage in accessible and supported and differentiated activity, which is led by experienced mental health trained music leaders to help build their confidence. And we've also talked about some of the physical barriers. So if a young person's a wheelchair user, our venue is accessible, and also we can arrange transport and taxis if need be to help them get to sessions. And the other thing to say is that our one-to-one sessions with individuals are scheduled to enable carers and key workers to attend and supervise young people in accessing activity if they need to be there, and also we can deliver sessions in hospitals and inpatient settings if necessary. In terms of waiting times and capacity, in terms of mental health services being overstretched, our young people are supported throughout their engagement with mental health services and on their mental health journey, and that can be from early intervention to crisis recovery and hospitalisation, so they can benefit whilst they're waiting for other professional support or when they're going through a transition phase. So it might be that they're referred onto the project when they're an inpatient to help with that transition back into the community. In terms of addressing isolation and social exclusion, obviously the professional mental health treatment would have addressed their medical and psychological needs, but it often doesn't address their social needs, particularly when young people might be admitted to hospitals far away from home, or they might be facing transition with a hospital discharge, as I just mentioned. So Wavelength helps to develop the young people's social interaction by building their friendships with peers who have a shared interest and obviously shared lived experience as well. And finally, if a young person's diagnosed with a mental health condition, they may find that they are a little bit confused about their identity and their self-identity and be coming to terms with a lifelong condition, and unfortunately associated stigma that brings with it. So they may also feel a lack of agency and control over the treatment that's happening to them and what's happening to their body as a result of their mental health condition. So through the process of writing music for the CD, completing an arts award, and just the general project sessions, young people involved actually steer their development. They steer the content of the music and the structure of the sessions, and this helps to build their self-esteem and self-worth because the project allows them to achieve. So it supports their recovery whilst allowing them to have fun. So in summary, using the power of music, Wavelength helps to build young people's confidence and self-esteem by enabling them to succeed and achieve at something. The project builds their emotional resilience by enabling them to connect with and talk about their feelings and emotions and communicate these in a positive way. And the project also develops young people's social skills as well, because it encourages them to communicate with others and to collaborate with others through the group sessions on the project. And that involves offering your own ideas, but then also listening to and compromising to build a collaborative or a group track. And then you need to look at all the different elements of music required to play in an ensemble and develop those skills to be part of an ensemble and be an effective contribution to that group. And obviously there's technical skills in playing an instrument that are required in playing in a group or producing your own track as well. The project encourages individual development through skills development and through one-to-one sessions, and then social development through the collaborative activities and the group sessions. And that then encourages positive mental health and well-being and helps young people to build their resilience. Most importantly, really, the project enables young people to have fun in a supportive and understanding environment, and they can make friends and connect with others who've got similar interests and experiences. The next video from ourselves will look at the project structure in more detail and just explain a little bit about how we've gone about recruiting for the project and how we make sure young people are supported in that development from the one-to-one sessions to the group activity. But thank you for listening.